Hello, it's me, Nurse Heidi. Checking in this month. It's March, the end of March, and we're here for another video. How are y'all been doing? Y'all been taking care of your skin and your cardiovascular health? Some preventative techniques, huh? Good work. Good on ya. Well, this month, we're going to do the gastrointestinal system. Woohoo! Before, I'm going to do one body system per month, and this month is the gastrointestinal system, bringing you preventative information to help us all take better care of our bodies, what we can do now, not necessarily, medications or procedures necessarily or anything like that, just things that we can do to encourage health and wellness in our bodies. So normally my best good friend Ayrton edits these videos, but she's on tour with her band Thinky Flesh. Woo! Shout out to Ayrton on the road. Y'all check out Thinky Flesh. She's on all music platforms, and maybe catch her on tour. But anyway, she's not going to be editing this video, so it's going to be raw and uncut. So excuse any awkward pauses or repetition, okay? I'm going to do my best to keep it good. Okay, so let me give my disclaimer. This is not prescriptive medical advice from me to you. These are preventative measures. I am not your healthcare professional. If you have any questions, you should contact your healthcare provider about anything that I present here. I'm not prescribing these things to you. I'm not liable or responsible for any actions you may take. Nothing I provide is meant to substitute for your personal, professional medical advice. It's not meant to be a diagnosis or treatment plan. Always consult with your physician or healthcare provider before starting any new healthcare regimen. That being said, let's move into mindfulness practice. We've been doing good taking our deep breaths, so let's just take a few deep breaths together. In your nose and out your mouth. Deep breath in and hold it for like 4 seconds. Hold it for 4 seconds, and then exhale for 8. Do one more of those. Very good. Additionally, let's think of 3 things that you're grateful for today. 3 things that happened today or that came across your mind that you're grateful for. It rained today for a little bit. I got to hang out with 2 very wonderful women in my life, and my sweet puppy boy is sitting right there. Those are 3 things I'm thankful for right now, today. It's good to be aware, these mindfulness practices. It's helpful to be aware of. It brings you into the current moment, brings your mind out of yesterday and out of the future and into the current moment, and helps you be present. And so you can engage fully with what's happening in your life right now, which is this video. And it's good to have gratitude and thankfulness. This decreases depression and anxiety. It helps you regulate your emotions whenever you think about what you care about and what you are grateful for. So there you go. Good for us. We're being mindful and grateful. Okay, the gastrointestinal system. What is it? What's it for? The GI tract is the hollow tube from your mouth to your anus. Okay, it's a continuous tube. There are sphincters and all kinds of structures along the way, but it's pretty much a hollow tube from beginning to end. The major function is the mechanical and chemical breakdown of food and the absorption of those digested nutrients. So we are going to do a little bit of a anatomy lesson. I wish I had some visual aids but I don't. I have like a textbook, but I'm not going to pick it up over and over. But anyway, starting in the mouth, digestion begins in the mouth with chewing. Your saliva has a lot of enzymes and things in it. So as you chew, it mixes with the saliva. And this begins the digestion process. It's important to thoroughly chew your food to an applesauce consistency to help really, really get that digestion process going. As far as mouth health, it's your saliva is usually an alkaline, an alkaline pH. So this helps to neutralize really acidic foods, and it helps to keep your teeth from having cavities and things like that. So to keep your mouth in good shape, pay attention to what you're eating. Try to avoid excessively acidic or alkaline foods. Drink plenty of water to help wash everything out of your mouth once you're done chewing up some food. And it's good to chew. It's helpful to chew sugarless gum with xylitol in it. It helps like pull all that, food residue off of your teeth, and then you can spit the gum out. It's helpful. It's been shown to improve dental health if you chew gum after meals. So then from your mouth, the food bolus goes down your esophagus, which is a hollow muscular tube, connects your mouth to your stomach. A thing called peristalsis takes over. You consciously chew and swallow, but from there, your autonomic nervous system takes over, and peristalsis is waves of sequential relaxation and contraction of the muscles in your esophagus right now to help pull that food bolus down all the way to your stomach next, which is a hollow bag-like structure that stores food. It squishes the food up, it mixes it with digestive juices, and then the food bolus is now called chyme, and it empties the chyme out into your small intestine. Typically takes like 3 to 6 hours depending on the composition or the amount of food in your stomach. Usually takes about 3 to 6 hours for the chyme to get all the way out of your stomach. Not a whole lot is absorbed in your stomach. Alcohol is absorbed in your stomach, and NSAIDs like aspirin, naproxen, ibuprofen, things like that. And we'll talk about those a little later. NSAIDs. Okay, so the chyme is coming out of your stomach into your small intestine. The small intestine is pretty much where all the magic happens, okay? Let's give it up for the small intestine. Yes. Okay, it is about 5 to 6 meters long, which is 16 to 19 feet. Oh, excuse me. It's coiled inside of your abdominal cavity, and it, right from your stomach, it gets into the small intestine. Digestion and absorption of all major nutrients and most of your ingested water occurs in the small intestine at differing sites along the way. And then as the digestion and stuff happens, the absorption occurs at the intestinal wall. So it's like a big long tube, and all on the edges of the tube are these little villi. I don't know if y'all remember that. Anyway, that's where all the absorption happens. So the chyme enters the small intestine. This at the beginning of the small intestine, the duodenum. This area, whenever the chyme comes into this area of the small intestine, it stimulates the liver and the gallbladder to dump bile into the small intestine. Also stimulates the pancreas to deliver digestive enzymes and alkaline secretions into that small part of the small intestine, and it all just mixes up and just breaks down that food more and more and more, and peristalsis continues to propel the chyme along the tract until it gets to the large intestine. Okay, so the large intestine is 1.5 meters long, about 5 feet. There's a lot of intestine in here, you guys. So about 5 feet long. The chyme goes from the small intestine into the large, and now it's called a fecal mass. Okay, And this fecal mass is propelled by peristalsis along the GI, along the large intestine, and in the GI, the large intestine absorbs more of the electrolytes and things back, and another portion of water. So the fecal mass is getting more and more like dried out and squished, and it makes it all the way to the rectum. And then whenever the fecal mass makes it to the rectum, it's stimulated by that pressure and causes the involuntary action of some of those. There's like 2 sphincters from the rectum into the anus that will cause you to expel the feces. There's an involuntary, and then there's a voluntary sphincter, so you can like not poop on yourself, so you can hold it until you're ready to go to the bathroom. So that's the GI tract as far as structure. The major function is, like we said, mechanical and chemical breakdown of food, and then the absorption of those digested nutrients. So there's multiple organs in the GI system, and then accessory organs with different functions all along the tract. Ultimately, the nutrients are absorbed mostly in the small intestine, and then the liver metabolizes all the nutrients and distributes them back into the blood supply, where it can go all over the body to building blocks for metabolism and all the things that are happening in the body. So that's like a lot. Our GI tract is doing a lot, okay? So how are we gonna care for this? What kind of prevention can we do? There's like 5 main things. One of the big ones, or to start with, is diet. It's literally the function and purpose of the GI tract, so we need to be mindful of what we're eating and how we're eating. Fiber is a big deal. Fiber is a substance that your GI tract cannot break down, so it adds bulk, and it helps you not have such a like watery poop. It helps build it up and prevents constipation, helps reduce irritation in your GI tract, and it helps food move through the GI tract, through the digestive system. Fruits, vegetables, whole grains are good sources of fiber. Probiotics, very important. Those are beneficial bacteria that support digestion. You can find this in yogurt, fermented foods, kefir, like sauerkraut, kimchi, stuff like that, kombucha. And then prebiotics are foods that feed probiotic bacteria. Things like garlic, onions, bananas. There's other things, and there are supplements, but generally speaking, it's always best to get your nutrients from whole foods. And some foods that could trigger or irritate your gut, and by gut we mean the lining of your intestine and the microbiome that lives there. There's your intestine is filled with a large flora of bacteria. Lots of bacteria in there. They're supposed to be there. They're good for us. It's kind of like a symbiotic relationship. We care for it. It cares for us. So some foods that you eat can irritate the whole situation down there. Processed foods like fast food, fried food, foods high in sugar and unhealthy fats can be difficult to digest, and this leads to inflammation in the GI tract, which leads to other problems like leaky gut that I'm sure you've heard of. It's a kind of a buzzword. It's very important. It's kind of like pathophysiology though. Artificial flavoring and preservatives, spicy food, and caffeine and alcohol and dairy, they can irritate your GI tract, but they're not quote unquote harmful. It's kind of like, can you, from person to person, can you tolerate these things, Yeah. So they can irritate you, but those are not necessarily like harmful to your gut bacteria. It's good to be aware of the food choices you make to promote a healthy lifestyle and prevent complications for your GI tract. There's a whole lot we can talk about food-wise and how different foods are metabolized and stuff, and how one food choice can be more helpful to your gut biome. Various components of your diet can aggravate and affect the gut biome and increase inflammation. Some of these more common substances are fats, high sugar. Some people are intolerant of gluten, artificial sweeteners, and a lot of this stuff is really common in the Western diet. So it's a matter of figuring out what really irritates your system and avoiding things that we know cause problems for the GI tract. That's how we prevent problems from occurring if we eat things that don't, disrupt the biome there. And then with food goes hand hygiene. Make sure you're washing your hands. It's the number one way to prevent the spread of disease and microorganisms, from you touching unprepared chicken or using the bathroom or playing outside in the dirt, then coming inside and eating a sandwich. You literally put those things that you touch into your mouth. And so washing your hands is the number one way to prevent transmission of that to yourself and if you're preparing food for someone else, Pardon me. Okay, so diet. Number 2, hydration, liquid water. It's vital for digestion, nutrient absorption, and waste elimination. Increasing your liquid intake helps decrease constipation. It helps formation of mucus in the GI tract. It helps just keep everything lubricated so that food bolus, chyme, and fecal mass can just move right along. So you want to increase your hydration. It helps with absorption because water is part of the transport system whenever things, nutrients and stuff cross over the intestinal lining. It's part of the absorption process. So, and it's particularly important to increase your fluid intake during physically stressful times, like when you're working out or, other times when you're physically stressed, or working out, your body's increased metabolic activity. So, number 3, exercise. Being active not only helps your heart and cardiovascular system, which we just spoke about last month. Exercise helps stimulate that peristalsis that we talked about, that waves of muscular contraction and relaxation that helps move the food bolus through your GI tract. So exercise helps stimulate that, helps prevent constipation by promoting regular pooping and reducing the time that the waste product remains mostly in your large intestine. So it also increases blood flow to the intestine, and we're not talking about anything crazy, just like last month when we were talking about what is moderate to, exercise, 120 minutes a week. Very good. And you can do it in increments. And, as walking or a light jog, 30-minute moderate exercise, per day will give you significant health benefits. So anything is better than nothing, and starting small is wonderful. So go for a walk. You could do some stretching, moderate exercise, and that would improve your GI health. Number 4 is stress. This is a big one. It has to do with the nervous system that innervates our bodies. So the GI system is pretty much wired by our autonomic nervous system, which runs the fight or flight, the sympathetic nervous system, which is our fight or flight response, when a grizzly bear attacks you and you have to get the adrenaline pumping so you can get away from that bear quickly. And the other part of the autonomic nervous system is the parasympathetic, which is the rest and digest, which is where we want to be whenever we're relaxing, sitting down to eat a meal. That's so there's lots of things that happen when one or the other is activated, but a big way that it affects whenever your body is in a stressful fight or flight situation, which we aren't typically in these days, but modern living, we're frequently in kind of like high stress, chronic stress states, and our body doesn't know the difference. So like when you're in traffic, or you know, you don't even have to be having a physical stimulus. If you're just thinking about, you know, high anxiety kind of state, thinking about all the things you have to do or responsibilities, or I don't know, the things that we stay stressed out about or whatever, those things trigger our sympathetic nervous system, and blood shunts to our heart and to our brain, help us make decisions quickly so we can survive that stressful situation. So whenever, all this to say that whenever that sympathetic nervous system is activated, there's not as much blood or resources to your stomach and your GI tract, because it's not imperative to you surviving this bear attack, quote unquote. So the solution, or the impact of that, is you won't be digesting anything very well if you're constantly in this stress state. So it's important to have mindful ways of managing the stress in your life in general, but for your GI health, okay? So it's good to practice relaxation techniques like mindfulness, meditation, prayer, physical exercise, finding pleasurable activities to reduce your stress, reduce your stress levels. This leads to a more balanced response of our autonomic nervous system, promoting a more conducive environment for adequate digestion and efficient absorption of these nutrients. Okay? We want to harness the parasympathetic, okay, the rest and digest. We need to switch out of this fight or flight into the rest and digest. So some ways you can do this while you're eating, or relative to the GI system. Whenever it's time to eat something, you want to sit down. It's good to sit down. Be mindful about, okay, I'm about to eat some food. You can take some deep breaths, like mindfulness practice like we've been doing here. Slow down, and like when you eat a bite, chew it fully, like we were saying, like applesauce consistency. Take time to like taste the food. We have all these taste buds. We get to taste stuff and everything. So take some time to enjoy the flavors. Try and be in a relaxed state. Put your fork down while you're chewing. So you have time to chew it, and you won't feel compulsively ready to just shovel the next bite in your mouth. Turn some music on. Enjoy the experience. Maybe not every meal can be like that, but that's a great goal. But that can be a goal to help harness that parasympathetic rest and digest. So we can enjoy the food we eat, so our body can effectively process all this food coming in, and it can absorb the nutrients. So one thing about being in this chronic stress state, it leads to inflammation within our GI tract, which can compromise our GI tract, contributing to that leaky gut we were talking about. It has to do with in the lining of our small intestine, mostly, because that's where all the villi are. The lining of our intestine, there's where the nutrients cross through and get to the blood on this side to carry it to the rest of the body, or to the liver and to the rest of the body and stuff. This barrier it becomes inflamed, and just like having a inflamed area on your arm, that skin or that tissue, that barrier is broken more easily, and these micro erosions in the intestinal wall, when it's broken, then bacteria, which naturally lives in our gut, can get into these places, and this activates our immune system, which we have a whole immune system in our gut as well, which is kind of another story, but it's all related, right? So the bacteria gets into our compromised intestinal wall, and this flares up, triggers our local inflammation and stuff, and this results in different kinds of GI disorders and stuff. So we have to maintain this epithelial integrity of our gut mucosa to protect all the underlying tissues and help with the nutritional and microbial environment of our GI tract. So all that to say, it's good to not be stressed when you're eating. So slow down and enjoy your meal so you can digest better. And then number 5, sleep. The gut microbiome is delicate and it thrives on balance and harmony, and sleep is crucial to maintain the equilibrium in our body, and regulate a lot of physiological processes that directly impact the gut, like immune function, circadian rhythm, stress response. It improves your motility and it enhances nutrient absorption. So sleep is paramount, and we're talking 8 to 10. There's research about that. Everyone's like, yeah, I can do it on 5 hours. It's like, you can do that, but it's not good for us long term. We're supposed to rest, you guys. Okay, so I talked to my GI nurse practitioner friend, and I was like, okay, what do the people need to know about? She said, constipation. I guess these are common things that she sees in her patients. Constipation, acid reflux, NSAID overuse, and colonoscopy screening. Okay, so we'll start with constipation. Constipation is characterized as fewer than 3 bowel movements in a week, or experiencing hard, difficult stools to pass, hard, dry stool that can be uncomfortable to poop out. Common causes are pretty much lifestyle and diet related. Lack of dietary fiber, insufficient fluid, sedentary lifestyle. We just addressed all those things. It could be contributed to medications that you take or medical conditions, but initially the way to address this is to address your diet and your lifestyle, increase your fiber intake from fruits, vegetables, whole grains, and increase your hydration to help soften your stool. You can try and schedule bathroom time or in physical activity to help further aid regularity. Try and train your bowels that I'm going to go every morning and sit on the pot or whatever. After you do some stretching or go for a morning walk or drink, a cup of coffee. Just try and train your body. There are over-the-counter medications like stool softeners, osmotic agents, things like that. But using these things should be monitored because you shouldn't use them for an extended period of time. We're talking about prevention here. I'm not prescribing medications or anything like that. But so if you get into anything like that, you need to talk to your care provider. If you start having any other adverse things like rectal bleeding, abdominal pain, vomiting, unexplained weight loss, abdominal mass, stuff like that, you need to be talking to your doctor because those aren't normal signs. Constipation is a abnormality, but you can, if you have worsening symptoms, you need to talk to your doctor. So that's how you fix constipation, diet and exercise, and if it kind of is beyond that, you need to be talking to your doctor. Next, acid reflux. This is a condition where stomach acid flows back up into your esophagus, causing irritation of the esophageal lining. Some symptoms are like heartburn, regurgitation, you can feel chest pain or difficulty swallowing or burping and stuff like that. dyspepsia. Some ways to prevent this are to eat slowly and to avoid overeating. Rapid food, whenever you eat rapidly and swallow quickly, it kind of puts extra pressure on, there are two sphincters in your esophagus, but it'll put extra pressure on that lower sphincter, and when that is weakened, that sphincter, after doing that for so long, or like eating a whole lot, it weakens that sphincter, and then it won't hold the acid down in your stomach as well. And so that can flow up back into your esophagus and trigger this painful, literal burning of your esophagus, because the stomach acid is very acidic. It's meant to stay in your stomach bag, like stomach pouch, and not go up your esophagus. So it's good to eat like 1 to 2 hours before bed, so you can, so you'll stay in a upright position for about 1 to 2 hours before you lay down, because when you lay flat, it's gravity, and if you lay flat and that lower sphincter is kind of distended from you eating a whole huge amount of food, then it's not going to help hold that acidic stomach content in your stomach. So it's good to stay upright for, it says, 1 to 2 hours before bed. Minimize carbonated beverages and alcohol. Need to drink more water instead. Carbonated beverages and alcohol cause relaxation of that lower esophageal sphincter and can trigger those symptoms. When you drink water, it clears the esophagus, and it helps clear those things and reduces your symptoms. If there are things you notice that trigger your reflux symptoms, try to avoid those things. Some things, common triggers are garlic, raw onion, chocolate, red wine, peppermint, citrus fruit. Those are some common triggers, but everyone's different. If you have recurrent acid reflux, even after making some of these dietary modifications and lifestyle modifications, it's advisable to talk to a doctor. Like if you're having persistent reflux and there's general discomfort and you can't do activities of your daily life, then it's something you need to talk to your doctor about, because it could be, a complication. Or if it's causing you to be nauseated, or if you begin vomiting, or if you're vomiting blood or coffee ground looking stuff, you need to talk to the doctor. It's not normal. Okay, next is NSAID overuse. What are NSAIDs? Glad you asked. They are non-steroidal anti-inflammatory drugs, known more commonly as ibuprofen, naproxen, there's more. I can't remember them all right now. But we use them frequently. They're available over the counter. Medical providers will prescribe them instead of opioid meds. They're used for analgesia, for pain control, to help reduce fever and to help decrease inflammation, which is very helpful whenever you have chronic issues or pain issues, headache, swelling, stuff like that. We use them all the time. They're one of the most prescribed and utilized medications, but prolonged use of NSAIDs leads to chronic exposure to your mucosal lining of this medication, and it can cause inflammation of your stomach lining. Different symptoms can occur, like dyspepsia, which is that burning feeling in your stomach, and and can cause belching, things like that. Reflux, nausea, abdominal pain, and it can be as severe as bleeding and perforations and chronic inflammation of your stomach. Sorry, talking to my dog. People that take NSAIDs are more likely to have reflux and heartburn and cough. and it can also like decrease the peristalsis and the tone of those sphincters we were talking about. So it makes you more prone to have those symptoms. If your stomach is not moving all the food bolus through your GI tract, and you have less toned sphincters, then like everything will pile up, and you can have that those reflux symptoms, and the NSAIDs will cause all of those things to happen. So it's kind of like a perfect storm. And you can have chronic exposure to your mucosal linings, and it can literally like burn the tissue, and it causes like blisters, and like it sears and cuts the tissue, and it can bleed and cause the inflammation that can get worse into bleeding. So consider the risk or benefit of taking an NSAID, whether you really need to take it, or if there's an alternative therapy you can use, for whatever your ailment is. It's helpful to take it if you are going to take NSAIDs, to take it at the end of a full meal with a lot of water, so you do flush it all the way down. It gets to your stomach, and it's not just sitting in your stomach. It's got food kind of with it to help buffer your lining, so it's not just sitting in there by itself. Limit alcohol intake, because alcohol can irritate your stomach as well. And don't take multiple NSAIDs with each other. Just take one, whichever one you're taking. If you're taking an aspirin or ibuprofen or whatever, don't take it with another NSAID. Okay, and last but certainly not least is colonoscopy screening. So this is a medical procedure, or whatever, for a colonoscopy, but it is prevention as well. So colorectal cancer is the third most common cancer among men and women in the U.S., and it's the second leading cause of cancer death, and it's very preventable. So screening is crucial to reduce the incidence of cancer forming and mortality. So the general recommendation was age 50 through 75, but they've changed it to begin at age 45 for people in good health with no increased risk. So starting at age 45, you'll talk to your primary care doctor about doing some kind of screening. There's two types of screening. They do stool tests where you poop in a box and they test it and see if it shows like DNA that is typical or of cancer. So you can either test your stool, or you can do a visual exam, which is the colonoscopy. So every 10 years is the recommendation. So if you start at 45, your next would be at 55. And so until age 75, and then from there you kind of decide with your care provider if it's worth doing. And then at 85 and older, they don't suggest colonoscopy. If you are at a higher risk because of like family history of colorectal cancer or polyps, or if you have a history of like inflammatory bowel disease like Crohn's disease or ulcerative colitis, you should start before age 45. You should be talking to your healthcare provider about when you should start screening, and you probably will be screened more often than every 10 years. So, it's just as camera goes up your butt. It's good, okay? It's if they can find a precancerous polyp and identify it, then that's how you prevent colon cancer. There's really no other way to find it until it turns into a mass or something, and so it's better to prevent that if you can, and that's one of the ways to do it. So either poop in a box or get a colonoscopy. I encourage it. So that's it, you guys. That's the GI tract in a nutshell. Okay, well, y'all have a great day, great month. I'll see you next month. Bye.